Lower cross syndrome is a dysfunction inside the body with alignment and what muscles are pulling. And so it can cause problems with the knee, with the hip, with sciatica, with the low back. So we want to take a deep dive and figure out exactly what's going on. We'll tell you what the signs and symptoms are so you can identify it and we can get it fixed. My name is Jonathan Rizika. I'm a doctor of physical therapy and I'm a specialist in back pain. We fix back pain, but we fix it by taking deep dives into the body and we look at biomechanics. You have to have a really deep knowledge about the anatomy and how the body's supposed to move. When we're looking at a problem, we know that we're having pain in our back. That's where the symptoms are at. But what's causing the back pain? What's causing the back to have that pain? What's causing that dysfunction? And that's why we're going to talk about lower cross syndrome. We have to dig deeper and go a couple layers back and figure out what exactly is causing this so we can fix it from the root. And when we do that, we get long-term outcomes and we stay out of pain. Now with lower cross syndrome, we have muscle imbalances. So muscles on the front side are tight or muscles on the back side are tight. And then the inverse muscle is actually loose, it's inhibited. And so we're gonna go specifically into what muscles are tight, what muscles are inhibited, and why we call it lower cross syndrome. Now, the first muscle to talk about is this psoas muscle right here. So this is the spine, looking at it from the side. Here's all the nerves coming out, going down into this gluteal notch, and that's the sciatic nerve. Now, this is the biggest hip flexor in the body right here. So it's the psoas major. And if this is tight, we have something in the body called reciprocal inhibition. If I flex my bicep as hard as I can, my tricep has to be loose. So if my hip flexors are tight, which most of us have tight hip flexors, if we're sitting in hip flexion all the time, then our muscles will tighten up and that inhibits the function of the glutes. When we're looking at this leg right here, we can see right here at the pelvis, we have the psoas coming down and the iliacus, the iliopsoas, they come together and they touch right here in the hip. And so that's the biggest hip flexor. Then we have the pectineus, we have the TFL, and we have the rectus femoris. So all of those muscles do hip flexion and they will get tight on us. And so if we're in flexion, then our extensors can't work. So what we're looking for is to fire up these glutes. Now the glutes are the biggest muscle group in the body, and if they're not firing, then we're going to do back extension instead of doing hip extension. And so that's where we talk about this cross pattern. The first thing to identify is, do you have tight hip flexors? We want to loosen that up because we can't get into full hip extension. We won't be able to stand up all the way through. If we have tight hip flexors, it's going to pull our pelvis into bad positions. Okay, looking at these two models, so we have these hip flexors right here, the psoas major. That's attached to the lumbar spine right here. So we're gonna be tight in these hip flexors from here to here. Now, on the back side of that is the glutes right here. So now this glute isn't gonna be able to fire. That's inhibited. Now, on the top side of that, we have our back extensors that will get really tight. So the hip flexors are pulling us forward and our back extensors fire up. Now the back extensors being fired up will make it inhibit our abdomen. So our abs aren't firing very well. And all of us have heard several times, like we need to have stronger abs to get rid of back pain. Well, it's really about having a balance right there, that we can stay in a neutral spine position by having our abs activated and having our glutes activated. And that's why they call it lower cross syndrome. So we are tight here through the hip flexors, crossing this way, and then crossing back the other way. We're inhibited in our abdomen and we're inhibited in our glutes. So it makes that X coming across, and that's why they call it lower cross syndrome. What we need to do is flip that. The muscles that are inhibited need to get strengthened up, and then the muscles that are overactive need to dampen down. Make sure you hit the subscribe button. We don't want you to miss out on any of this content. We're going to go do deep dives into the anatomy, what the biomechanics are. What we're looking for you is a deep understanding of how your body moves so that you don't go through degradation and you don't have more pain than you should. Now, when we talk about the spine, so when we go into flexion, we put a lot of pressure on the disc and it'll put pressure on this nerve right here. When we go into extension, it closes down that space where the nerve is coming out between the vertebra. So when we have that muscle right here, the psoas pulling on the spine, it's pulling us into extension right there. So we have the psoas pulling right here. And then when that goes into extension, when it starts to tilt forward like this, into an anterior pelvic tilt, now I have pressure on those nerves from the pull on the front side, but then also because it gets into a shortened position with my back extensors, now I'm firing up my back extensors. So they're paired improperly together. And this happens from sitting for long periods of time or lifting incorrectly, or being sedentary. If we're not firing these muscles in opposing ways and we don't identify what this problem is, then we're just going to keep feeding into it. So what we're thinking about is being in a neutral position. We want to create as much space for these nerves as possible. So going into extension, being pulled this way and then being pulled back here is not going to be productive. Another negative part of tight hip flexors is actually this attachment point coming right here. It's attached right here at this lesser trochanter on our femur. And so it'll pull us up and in, if I can get this thing to move like that. So it's grinding into the joint right there. So that muscle's coming down and it's pulling and it's cramming that joint together. And so we have cartilage around the bones. In between each part of the bone, we have cartilage. Cartilage is like a sponge. So when we squeeze out a sponge, the water runs out of it. If you leave it in the same bowl, then it'll suck that water back up. And that's how our cartilage functions. If we constantly have pressure on the front side of that hip, which is typically where it is, if we constantly have pressure on it, we've squeezed the fluid out, but we don't get the opportunity for it to come back in. So, and that's where we have a problem with it. So the tight hip flexors are causing us a problem right there, but they're also causing that problem in the back as well. Now, an anterior pelvic tilt is happening from the tight hip flexors, from the back extensors, but our abdomen and our glutes aren't fighting against that, and that becomes a big issue. So we're using, when we go to stand up, I'm in this position, so I'm causing that compression in my back, and I can never fire my butt really well from this position because I need my hips to come up underneath me. Now, a lot of people will go through a posterior pelvic tilt. So they go from this position, they want you to just tilt right here. That's not the most effective way to do it, because if I'm constantly doing this tilt back and forth, I'm just causing irritation. My back already has irritation on it. Do I really want to move through it consistently or constantly? I don't want to cause that consistent hypermobility right in that area. I want to decrease stress in those areas. So increasing mobility through the thoracic spine so we don't have so much pull right here, and then firing up our glutes. Those are the most effective things that we can do. So if you can work on your hip flexors, loosen these up. So we actually loosen up this tissue right here. If you want a video on that, exactly how we do it, we use a Mobo, we use lacrosse balls, we use a stick just to drive in there and loosen this pressure up. We'll loosen up that muscle, and then we'll use that lacrosse ball and we'll roll out the glutes right here. So we'll dig into these muscles. Where muscles overlap, they get stuck together. So we're going to dig out these muscles in the glute, and then we're going to fire up the glutes. And we're going to do glute-specific exercises, clamshells, side-lying leg raise. Lunges are too intense right now. So another byproduct of having our glutes inhibited is that when we do a lunge, that our knee will start to tilt forward. It'll go forward and it'll go inward. So we get an internal rotation of this femur right here. That puts a lot of stress on the inside of the knee. So we've got to fire up those glutes. So number one, we need to be loosening up our hip flexors, and number two, we need to be strengthening up our glutes. And those are going to be the most effective things that we can do with lower cross syndrome, because we're going to be directly focused on the hips. And so it's about an 80-20 rule. 80% is going to be focused on the hips. That's where our power comes from. And then 20% is the abdomen. So we want to focus 80% of our attention on this area. Now, 80% of my attention is focused on this area and driving through here. Now, 20% is the abdomen. So if I'm turning and I need to not hyperextend in my low back, then my abdomen has to kick in right there, and then I can walk normally. I turn and my abdomen kicks in. But the power generation is going to come through the hips. So when you're looking for interventions of how to change lower cross syndrome, we're looking at the hips. We're going to loosen up those hip flexors. Then we're going to loosen up the glutes, fire them up, do exercise specifically focused on that. We're going to do ab work like planks, just maintaining positions. We also do a Palloff press where you have pressure off to the side, a band, and then you're pushing straight out and you're maintaining stability right here. And you don't need to do anything for your low back. This is a common misconception when our clients come in the beginning, they say, hey, I'm strengthening my low back because they've seen it online and all these different places. The simple thing to say is that they're wrong. You do not need to do back strengthening exercises. You shouldn't be doing exercises where we just crank on our low back. Your low back is doing too much because the majority of the population has some form of lower cross syndrome where they're tight through their low back, and then we're just making it tighter consistently. And then the other thing that we see often is that people feel tight in their back, so then they just stretch through their low back. That's not going to give you any long-term improvement because the glutes aren't firing. We have to wake up the glutes, and that's why I keep talking about this, is we have to wake up the glutes to keep us from doing back extension. So when I get up from this chair right here, I'm gonna come up like this. If my glutes don't fire, then I throw my momentum, my back leads it. So wherever your head goes, your body follows. So what I wanna do is shift my hips back, my chest comes down, I reach back sitting down in the chair, and when I drive back up, I push through my heels, my chest comes forward down to my thighs, and I drive up. I'm using my glutes, I'm using the back of my leg. Now with these interventions of loosening up the hip flexors, firing up the glutes, and firing up the abdomen, we just want to rinse and repeat. Those are some things that we're going to do in the gym, at home, consistently. If you can get in a gym atmosphere and start loading yourself with weight, maintain stability with your planks, fire up the glutes, and increase in pressure. So think about it on a weekly to bi-weekly basis where you're just increasing by 5 to 10 pounds on those muscles. Take it slow and let those muscles wake up. We have a Neuraxin EMG, and so it's a topical electrode. We put it on muscles, and typically the glutes, we'll check the glutes, we'll check shoulder blade muscles. Instead of sending a signal to the body, it actually reads the body and tells us how much activation we're getting, and we can see it on an iPad. If you want a more deeper dive and look at that machinery, then leave us a comment, let us know. But we'll see on an iPad how much activation we're getting out of the glutes. And so then we can track it over a period of time. And what we found is that the first 2 weeks, it's really important to just get motor activation, to do isometric holds. So me just standing here and squeezing this glute right here, I'm just firing that up and I'll hold it for 30 seconds. What happens is that if this, let's say this is your entire glute muscle, or since I have a glute muscle, let's say right here, these fibers are firing really well and these ones aren't. So when we do a sustained hold, I'm holding it out to the side, I'm laying down on my side, I'm holding this up and squeezing. When these fibers fatigue out after, say, 20 seconds, then my brain will recruit these fibers. So I'm waking up those fibers. And let's say it's 5% every time you do it. So 5%, just chipping away at it, chipping away at it. Once I get those fibers woken up and firing, then I can go do a strengthening program. I can start getting more strength in those muscles, and then I can get hypertrophy. I can start building the muscles up. While we're doing that, we'll start increasing your load in the gym when we do lunges, when we do squats. We don't have to do weight with those exercises, but doing a lunge, doing 10 lunges, that's so functional. Getting up and down from the ground, that's what our goal is for all of our clients. We have a client, and he's 94 years old, and he's able to do a lunge because he's able to get up and down from the ground. That's why it's our goal. Getting up and down from the ground is a really important functional movement. We should all be able to do it. We don't want to live a life where we can't go below our knees. We want to be able to get up, move around, and have that mobility and independence long term. So follow us on this channel so you can get more information on exactly what we're doing, how to activate these muscles, and what exercise we do through progressions so you don't do too much too fast, but you consistently make improvement. Let us know if you think you have lower cross syndrome, and give us a description of exactly where your pain is. Hopefully we can help you directly to figure out exactly how to fix this. Check out the video here on the screen. It's going to go through a clear fix on lower cross syndrome so you can start moving in the right direction. We'll see you in the next video. Get mobile and stay active.